Okay, let's talk about viral complications. There are some viruses that can cause like encephalitis, swelling of the brain, viruses that can cause meningitis, swelling of the meninges or the spinal column, um, and those can be cause bad complications. Um, there's a Haemophilus influenza type B. It's it can also cause some real problems with meningitis and things like that. There's bacteria and stuff like that. Um, and so I want to bring some understanding to that space too. So a couple of weeks ago, had a patient come in, typical virus. She actually tested positive for adenovirus and rhinovirus both. And she ended up experiencing a super, super rare complication from a virus, like 2 per 1 million or something, like very, very rare. And it's called MOGAD. Anyway, so she almost became encephalopathic and ended up in the ICU and the NICU. And she did become encephalopathic and almost died. It was a big deal. We got her safely to the hospital and safely taken care of, and she's doing fine now. She's recovering. And so that's a big deal. Encephalitis is a big deal. So that would be like floppy. They're not responding well. Get them to the hospital. Meningitis is my back hurts like crazy. Tuck my chin down and it hurts. I can't even do it. And so get them to the hospital. Those are bigger deal things. Respiratory distress, some of these viruses like RSV, respiratory syncytial virus. I just hospitalized a kid 2 days ago with RSV, and he just wasn't keeping his oxygen sats up high enough for me to be comfortable sending him home. And so respiratory syncytial virus can cause inflammation of the airways and cause like a bronchiolitis. And any virus can cause this, frankly. If you have asthma, it can cause an asthma exacerbation. Any virus can do that. And so if you're struggling to breathe, color changes, those kinds of things, obviously you want to get checked out. Can cause some exacerbations of your airway problems and things like that. And so, could require oxygen just to kind of wait out keep you alive while your body fights the virus and kills it. It's fine. We just support those kids. And so I think he did fine. We just watched him a couple days in the hospital and on oxygen and, getting him all squared away, and he did fine. And so, those are kind of some of the outlying situations that you want to look for. In infants, small infants, the common viruses can actually cause some pretty bad complications. So like RSV. In me, RSV is just going to cause sore throat, maybe a runny nose. In an infant, it might cause bronchiolitis, which is the inflammation of the airway, and then they're going to show some signs of respiratory distress. Little kids, small infants, they're going to show you like rocking. They might rock when they breathe. They might grunt like this. And those will be signs that they're in respiratory distress, and that would be an urgent situation. Get them to the hospital. Kids usually have a very small reserve, so they crash pretty quickly. So don't hesitate on that stuff. Respiratory distress in infants is going to be like, you see like labored breathing. They might rock. They might breathe really rapidly. Those are signs of respiratory distress. Rib retractions, where the skin underneath the ribs kind of goes under when they inhale. Those are all signs that it's a big, big deal. And so overall, if you feel bad, go to see your doctor. And if it's getting super bad, get to the hospital. They'll support you. One of the beautiful things of the Voyage Clinics is that our clients have easy access to us with telehealth and video chat, and they can just call us anytime. And it's your doc that knows you. And so we just talk it through and help them navigate some of those waters. Right now with insurance and copays, deductibles, confusion about coverage, a lot of mamas are just Googling stuff in their basements, not sure what to do when. And that's another part, or the reason for this podcast, is to bring some education around that space so they can understand, when to act, what should I do, and all those things. It's just a beautiful thing to be able to be available and accessible to these families as they're trying to navigate the viral waters of wonkiness. So happy to help out. Okay, let's talk really briefly about more viruses. So we talked about kind of kind of systemic viruses. Last time we talked about respiratory viruses, GI viruses, pharyngeal viruses that cause like pharyngitis. Now I want to talk about skin viruses. There's some really common skin viruses out there. Skin viruses that affect the genitalia, which would be the HPVs, vaccinations for those now for both men and women, which are pretty cool. HPV, what's the big deal there? HPV causes, there's like 4 strains that predispose you to cervical cancer, females to cervical cancer. And that's why we've created vaccinations against those strains. There are HPV that just cause genital warts, the external ones. They're not usually the same ones that cause cervical cancer. So that's the thing. And guys often have it and don't even know because it's just very mild in guys infection-wise. And so they spread it around, and that's how ladies end up with it. And so that's why the vaccine is for both males and females. Typically in the adolescent years when we recommend folks get that. And so that's the cervical cancer causing HPV virus and genital wart causing HPV virus. Let's talk about other ones. So you've got the shingles virus, very, very common. Immunocompromised people with diabetes, people with multiple diseases or things, they can get shingles. Anyone can really get shingles. If your stress levels are really high, your cortisol levels are really high, you could get shingles at any age, anytime. We typically vaccinate older people for shingles, and then chickenpox for younger kids. And shingles is the same virus there and just affects differently. Usually follows a dermatome. So what's a dermatome? Dermatome is a line of a nerve. So off of our spine, we have these little nerves that kind of travel around to the front. So from our spine around to the front. And that means it's a dermatome. So maybe like the T1, T2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Then you got the lumbar dermatomes, you got cervical dermatomes. And so they'll usually follow a line. They usually don't go down both sides. So that's one of the ways that we know that it's shingles. It's like, oh, look, there's a patch there. There's a bunch more blisters there. There's some more here. And it all goes around the same dermatome of the, T6 or T10 dermatome. And so super, super common. Super important if you get shingles to get treated within 24, 72 hours. Again, it's nice if you have easy access with your doc like we do. We give our clients easy access because then you just text us, say, hey, I think I got shingles, and then we got it covered. But if you don't, be sure to get in to see somebody within that 72-hour period. Sometimes shingles will come on without even coming up with the blistery rash thing. It'll just be like following a dermatome, pretty bad pain. Still important to get treatment if that happens too. So lots of people don't know that. So putting it out there. Other viral rashes you have Molluscum contagiosum, super common, affects kids. There are these like little tiny bumps. Lots of them, super common. Tons of people have these. So they'll affect legs. They can be all over the place. They have like a little umbilicated center, like a little nub there, like a little hole. And often you can express a little white core, like a little white head thing out of that. They can spread really easily if you do that. And so that can happen. They're usually self-resolving, but they can take months and months. Ask your doctor if you want to treat them more aggressively. Lots of ways to treat Molluscum contagiosum. What about common warts? You have flat warts, you have plantar warts, you have common warts, and they all affect the skin, the raised wart thing, and lots of ways to treat those too. Again, just work with your doc. There's some other treatments that work as well. But yeah, those are all very, very straightforward viral infections of the skin, and super fun to diagnose and treat and help people with. Again, just a podcast, not intended to be medical advice. Talk to your doctors if you have any of these things, if you want additional understanding around them. Thanks.